Before we begin, a note of warning. The topics we are about to explore may not be suitable for our young listeners. Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Scharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. I am sleeping. Now, I don't know if you went through this, but for a few years, I was waking up in the middle of the night for hours and could not fall back to sleep. And then the next day, I was absolutely exhausted. So
yes.
Now I figured out how to solve that problem, and we're going to share it with our listeners
that's excellent.
in a minute. But yeah, me getting my sleep is very, very important. So I'm glad I solved that problem. So
Good.
Here's, it got me thinking about it because we got an email from someone. Hi, Jill and Andrea. I am a 50-year-old woman and have been experiencing terrible insomnia and night sweats over the last few years. I know I am going through menopause, and all my friends say it will pass, but I wonder why I have to suffer through it. Is there anything that can be done from a holistic standpoint that can make this transition easier for me? Thanks. Love the podcast. Keep up the good work. Chaya. So we're here to say there is something you could do about it.
Great.
You don't have to suffer. Your husband doesn't have to suffer.
Your children don't have to suffer.
Your children. So today's guest is Dr. Guy Citrin. He is a licensed naturopathic doctor, a member of the California Naturopathic Doctors Association, Endocrinology Association of Naturopathic Physicians, and a nationally recognized speaker on gut health and restoration for Microbiome Labs. He received his doctorate at the National University of Health Sciences and was a resident at a renowned affiliate site through the University of Bastyr before relocating to Los Angeles, where he currently practices. Dr. Citrin's focus is to identify the root cause of the dysfunction and that he only prescribes pharmaceuticals when appropriate and correcting any imbalances using natural means as much as possible. He focuses specifically on chronic disease, gut health, joint pain, hormone optimization, anti-aging, and regenerative medicine. Hey, Dr. Guy.
Hey.
Hi.
Hi.
Well, that was a mouthful.
Yeah, but so thank you so much for joining us today.
Thank you for having me.
So we want to talk about female hormones. So maybe let's just explain what hormones are. Like, what are they? Why, when they're so out of balance, even a little bit, they can have such an effect on our day-to-day life?
Yeah, so the actual definition of a hormone is just a messenger signal. So it's just one area of the body usually sending a messenger signal to another area of the body, indicating a message. That's it. That's what a hormone is.
Okay. So now, if the hormones are imbalanced, like I said before, it could disrupt your health. So there are ways to balance hormones. There are pharmaceutical ways, there are more natural ways, and you specialize in doing it through more natural and holistic methods.
Yeah. So if we're talking about menopause, because hormones vary, in all ages of life. So men experience a lot of hormone disruption, women experience a lot of hormone disruption. There's a lot of causes to hormone disruption. But if we're specifically focusing on menopause, basically in menopause, the female will stop producing hormones. So there are three major hormones that are affected. There are testosterone, progesterone, and then cortisol and the effects of cortisol and adrenal gland dysfunction.
Mm-hmm. So wait, I know estrogen, right?
Excuse me, estrogens. Yes. Yeah. Sorry. Estrogens. I forgot the third one. So estrogen, testosterone, and progesterone are the three main hormones. And then those have an effect on cortisol, which you mentioned sleep. So that's kind of why those three chemicals associated with cortisol have an ill effect.
Right. Okay. So, so those get out of balance through menopause, and some people feel that more dramatically than other people. Like, I guess I'm sure there's some people who sail through these change of lifetimes not feeling anything. And then there are people who are, you go out to lunch with them. I have friends like this, and all of a sudden they get beet red and they're sweating and they're hot. Okay. So let's maybe for a second, let's talk about, so hormone besides, age, stress, poor food choices, not getting enough sleep, taking pharmaceuticals, those can all throughout anybody's time in life affect their hormone imbalance.
Yeah, 100%. And so what is now being kind of discovered is how much effect the gut has on the endocrine system. Mm-hmm. So it is now hypothesized that about 50% of all of your hormones are created and metabolized in the gut. And so a lot of people associate, okay, well, it's my ovaries or my adrenal glands or my hypothalamus, right? So the glands that we normally associate with production and the metabolism of hormones, we're now recognizing there's a massive increase in those productions through the gut itself. Mm-hmm. And so gut health, as it plays in with people's health, also has a massive effect on their hormonal status.
Right.
And so, so at this point in my career, I can't really eliminate I can't separate those two. So I have to always combine gut health with hormonal health. Mm-hmm. And that combination, when those systems are kind of optimized, the person feels a lot better.
Mm-hmm. Interesting. Okay. So it's not just like in the Western medicine world, they would just kind of give somebody hormone replacement therapy and send them on their way. And what you're saying is it's really not that easy. So, okay, let's talk about some of the signs or symptoms that somebody knows that they're going through a hormone imbalance. So
every single area within a female's reproductive cycle, right, will have associated chemicals and their own set of symptoms in that issue. But menopause is kind of the easiest in terms of understanding, and also the area that women feel kind of the worst at if they're not being taken care of properly. And so I always tell this to my menopausal patients is that you just do not need to have any symptoms. It's not necessary at this day and age to incur menopausal symptoms. So menopausal symptoms generally are fatigue, irritability, a lot of hot flashes, night sweats, low libido, weight gain, just anxiety overall. So just kind of like feeling blah is generally how they come in, and then sleep irregularities is a big one. A lot of women stop sleeping properly.
Right.
And so much of that is attributed to progesterone. And then you don't need a lot of estrogens and testosterones to kind of balance the levels. Mm-hmm. So usually I'll just talk about kind of my general understanding of it is usually the first thing that we do is we kind of help the gut. So first and foremost, a lot of times with night sweats and hot flashes, it's phase 3 detoxification of estrogens. And what I mean by that is estrogen will metabolize in the gut itself. And so if it's not properly metabolized, you may have estrogen issues. And so oftentimes what I'll do is I'll help the liver and the gut clean itself out. And so some women that prefer not to be on hormones at all, that'll be enough of a reduction in their symptoms in which they're happy.
Right. So you're talking about there's an estrogen dominance. There's too much estrogen built up.
There can be too much estrogen or too much. Yeah, that could be an estrogen dominance issue, or there could be an estrogen insufficiency issue as well.
Right.
Oh. And so a lot of that has to do with the way estrogen is packaged in the gut. Glucuronidase is really important for that. And so there's some enzymes that are responsible within the gut and the liver for the metabolizing, recirculating, and excreting the estrogens properly. Mm-hmm. And so oftentimes in menopause, that's going to be an issue. And so when you kind of help the gut and the liver process out the hormones and clear them more efficiently, a lot of those symptoms can go away.
So, right. So what are some, I realize this is very personal, it's individual to each person, but for example, like what are some of the interventions you would use to facilitate that?
So usually we kind of created a detoxification protocol that really helps use a variety of herbs and supplements to help the liver optimize And then things that you could do at home that are pretty simple are like flaxseed or psyllium husk, depending on symptoms.
Right.
Psyllium husk can be ill tolerated depending on the patient, so that does need some sort of evaluation usually, but especially if like bowels are loose, and there's gut pains or there's bloating or cramping
Right.
and that kind of stuff, then really like regular bowel movements are very, very important. And so regular healthy bowel movements is usually the first place that I start.
Mm.
And then along with some very strong herbs for clearing out the liver that are safe generally for most patients. And so I use kind of a supplement protocol, depending on the patient and what they're kind of facing, to eliminate a lot of the toxicity within the body, lose a little bit of weight, and then have healthy, consistent bowel movements. And that's a very healthy place to start.
Right.
And then that'll help a lot of the symptoms kind of initially, especially with fatigue and that kind of stuff.
Right.
And then usually, the addition of bioidentical. So I don't generally like synthetic hormones.
Right.
I really advocate bioidentical hormones.
Right. So you're talking synthetic hormones or things like Premarin.
Yes,
which
exactly.
It was highly, prescribed to women who are going through menopause. First of all, I just also want to say, make sure if you're experiencing these things that you do talk to somebody who's trained and who can help you alleviate the symptoms. Hopefully a naturopathic doctor. Dr. Guy's here in LA. I don't know if you talk to people outside of the state, if you can, but, just make sure you have some guidance here, because just from a personal standpoint, I was experiencing probably perimenopause, and I'm not a patient of Dr. Guy's yet, but my doctor here in LA, he was able to put me on a protocol and use bioidentical hormones, and I started sleeping again. And I want to yell this from the rooftops, that women don't have to go through menopause and suffer. It's really, there are things out there. As a matter of fact, my mom, who is, she's 75, I finally convinced her to go to someone in her hometown who has a compounding pharmacy, and she wasn't sleeping. She had restless legs. She just, within a month of this woman prescribing her some bioidentical hormones, her life has changed.
Okay. Can you guys define for people who don't know what bioidentical hormones are?
Yeah, sure. So bioidentical hormones are hormone mimickers, meaning they look biochemically the same as your hormones. Generally, they're made from yams, and they're compounded in a pharmacy. And the nice thing about them is you can prescribe, as a physician, you can prescribe the exact dosage of what I want in a patient. So depending on their age and what they're kind of going through, I can prescribe a very almost exact molecule that their body would have been producing. And as just mentioned, it's phenomenal. That's what I tell all my patients. You do not need to suffer with menopausal symptoms through menopause.
Right. I also find the bioidentical hormones that I can actually adjust them as I need them. Like if I have 2 nights in a row where I know my sleep quality is not what it should be, I can take a few more drops of sublingual progesterone, and that will help me ease me through it. So it's not like you're just taking that same, 30 microgram pill every day. Like based on how I feel, I can adjust how much I'm using. So I like that, to have that ability to do that also.
Yeah, I think bioidenticals are phenomenal. I personally, clinically, what I see is the bodies tolerate them super well. A lot of women are scared from a breast cancer perspective because sometimes we add in estrogens. There's been tons of studies. There was a major meta-analysis and another recent study, and it basically indicated that the likelihood of developing estrogen-dominant cancer on estrogens is lower. And if you do, the women respond better to chemotherapy who have been on bioidentical. So, which is fascinating. So, I really, unless you have a dominant cancer that's estrogen, then of course you're not a candidate for bioidenticals. But really, that's really the only time that I've seen it.
Right. And let's talk that Premarin. Where does Premarin come from? It's not bioidentical to what we have.
It's from horses. Yeah.
Horses. Yeah. It's from the urine of female pregnant horses, right?
Right. Exactly.
So,
and so it's not an exact replica of your own hormone. And so technically it's in that way, it's synthetic. And I don't feel that it's, as good. So if you're going to choose to put hormones in the body, which I think is a delicate decision in general, my advice all the time is use the one that's most similar to the one that you create and that has the least amount of side effects.
Right.
And so that's why I use bioidenticals generally as advice. So in terms of the protocol, the question was, so what do we do for a lot of these symptoms? Is one, for a couple of weeks, we kind of clean, detoxify, help the liver process, help the gut, create a little bit more stability, kind of reduce some of the gut stuff, because probably 95% of all the females that come in also have some gut stuff when they start hitting menopause. And the biggest complaint is then a weight gain. So then what we do is generally once we kind of get the bowels moving a little bit more regularly and a little bit more consistently, then I usually add in hormones, because it's important to add in hormones after you detoxify, specifically because you don't want hormone to build up. And so so the science is a little complicated, but there's some biological pathways that help with all the hormone cascades from the liver down to the colon and out. And so you want those pathways working as most efficiently as possible. And what I mean by pathways is just literally chemicals transcribing to other chemicals. And so if the system is functioning correctly, all the pathways are working well. And then when the pathways are working well, your ability to receive additional hormones is much better tolerated.
Right. Okay.
So I always try to help the system regulate naturally as much as possible. And then if the symptoms are not eliminated, then to add in bioidenticals. And that usually only takes a few weeks to determine anyway.
Yeah.
So
yeah.
Yeah.
Go ahead.
One thing I'd like you to sort of just elaborate on a little bit, because I think a lot of people, especially in Western society, aren't on top of this as much as they should be, is what you would consider like healthy bowel movement pattern.
Yeah.
For people.
So from a healthy bowel movement, again, that's very individualized, but generally a healthy bowel movement is 1 to 2 times a day, kind of by the clock, usually after you have a meal.
Right.
And it's just regularly consistent, medium brown, not too soft, not too hard, but just a decent consistency. And
and you're not straining.
You're not straining, and so oftentimes at that age there's a lot of hemorrhoids and there's a lot of gas pains and bloating and all that stuff. And all of that comes from improper movement. And so when I lecture at conferences, I talk oftentimes about serotonin and all the neurotransmitters and all that stuff that has an interplay with estrogens. And so not to get it too medical, but when the systems are functioning properly, you should receive just general healthy bowel movements 1 to 2 times a day, good consistency, not a lot of straining, not loose, not falling apart, not diarrhea, not constipation. Just and in that state, we know most of the bacteria is then functioning as it needs to.
Right. What's so crazy is these days we actually have to explain what that is, because I think there's so many people who don't really know.
Or people will say to me, because I'm a doctor, so I sometimes take this history with I see kids, right? And they say, oh yeah, right, they're not constipated. I'm like, well, like how often are they having bowel movements? And the parents like, oh, 3 or 4 times a week. And I'm like, no, like we got to work on something here. Like that shouldn't be.
Right. So Dr. Guy, any tips that you want to leave our audience with? Any kind of things that they should know?
People are often afraid of soy as a phytoestrogen. One of the tips that I have for females is soy is very beneficial if it's non-GMO.
Right.
It is a phytoestrogen. It will modulate your estrogen. It's a great thing to add into your diet if it's processed properly. So if you're going to eat soy, which again, don't be afraid of, just make sure it's not processed. It's not the processed GMO soy. And then can potentially be very healthy. General tips is add flax, add psyllium husk, get your bowels regular as much as possible. And if you need a doctor to do bioidentical you can find one near you. We do tele-Zoom conferences. More than happy to help anybody suffering with this, because I hate hearing that females experiencing symptoms at that age, because it's just unnecessary. It's honestly, it's just not necessary.
Right. Yeah,
So,
no, I can totally
Right.
attest to that, and how much it's helped me. And yeah, there's ways to get around it. So, all right.
Good.
Well, Dr. Guy, you can find him at drguy.com. He's on Instagram and Facebook at Ask Dr. Guy. You can also follow me on Instagram at Jill Scharfman. I want to thank our engineer, Mike Casantini at the Network Studios. And thank you, Dr. Guy. We will
Thank
go
you.
get some soy
thank
and
you guys for
some
having us.
flax
Yeah.
seeds. And yeah, no, that was, I like I said, I really feel like this is such an important message, and people are just not aware of it. So that's
Right.
what, we're trying to do is make people aware that there is help out there. And, I know we concentrate on menopause today, but, even if there are people who have PCOS or fertility issues, there are ways to get help with that too. So,
Yeah, 100%.
yeah.
There's
yeah.
no reason why people should be suffering.
Yeah.
So that's what,
Yeah.
there's answers out there.
Yeah,
So
great. All right. Well, thank you so much.
Thank you.
thank you for
Okay.
having me. Appreciate it. Have a great day,
Thanks.
guys.
You too. Bye.
Thanks.
And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004. Post on Instagram, Twitter, or Facebook with the hashtag #LetMyPeopleEatPodcast. If you like this show, please make sure to leave us a 5-star rating and review on iTunes. Tell your friends and family, and subscribe to us on Apple Podcasts.
And please remember that although we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own health practitioner about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I'm Andrea Moskowitz.
Thanks for joining us.
And go in good health.